menopause is normal, suffer with the consequences.
I mean,
I'm being a little facetious, but that's kind of how it went
No, it
down. So there is a really good revolution right now in women's hormone replacement therapy, specifically talking about menopause, perimenopausal symptoms. I think for several decades since the 90s, women essentially were not given any hormone replacement. They were told, you know what, menopause is normal, suffer with the consequences.
I mean,
I'm being a little facetious, but that's kind of how it went
No, it
down.
was, yeah.
Prior to the Women's Health Initiative, many women were getting hormone replacement. A lot of the docs I spoke to were doing it, and then overnight, essentially, that just changed because the Women's Health Initiative said, this is dangerous, women are going to get cancer. Now, there's a lot of issues with the study, the way the statistics were reported and claimed how many women are actually getting cancers, really different from the reality of what the study actually showed when you get into it. In reality, the main thing is that the increased risk of breast cancer in an average woman, what I mean by average, someone who's not high risk already for breast cancer, doesn't have a long list of family members with breast cancer, hasn't had breast cancer themselves, kind of the average woman walking around, the baseline risk is about 12% of getting breast cancer in their lifetime. With combined estrogen and progesterone, and that's important, the WHI showed that the risk went up by 8 in 10,000. So that's 0.08%.
That's actually not bad.
Not still a risk.
Right.
They're right. There was a slight increase, but it is with the combined.
But there's a risk with everything, like no matter what you take. So
Everything. And that's the thing. They completely missed the risk benefit. So many women are suffering. Yeah. And it's not just symptoms that women feel. With menopause comes bone mineral density loss, insulin resistance,
there's a bunch of stuff.
Emotional issues.
Getting attacked.
So no, I mean palpitations, migraines, so many things can develop that can impede your quality of life and actually impede your longevity of life. Fracture risk's huge. So that wasn't always factored in. And now we're seeing improvements in how that study was interpreted, new studies coming out, and we have better medication. So this, I think, conversation is kind of about what we really know, what we don't know, and kind of the current practices.